I cannot carry my child and I couldn't walk. But in an adult, normally 25,000 to 30,000 breaths per day. So morbid obesity. So the BMI increases. Somebody is 30 kg, 40 kg, more weight. Hello, welcome back. The topic today is breathlessness or short of breath. So most of the people come and say, "Doctor, I'm not able to walk freely nowadays. I feel breathless. I have to, take rest and I have to walk. I cannot carry my child and I couldn't walk. Climbing stairs becomes more, difficult nowadays. I couldn't, I'm taking too much of rest to, recover. These are the complaints most of the time that people say. Breathlessness or short of breath. So mostly why we breathe, we breathe because oxygen has to go in and carbon dioxide, the bad, the air has to come out. So that is the idea of breathing. And normally in any healthy adult, usually they breathe 12 to 20 times in a minute, or in a day 25,000 to 30,000 times a day. Now children, they breathe more, but in an adult, normally 25,000 to 30,000 breaths per day. But most of the time, the person may not be aware that they are breathing. We do it effortlessly without our knowledge. Subconsciously, we are breathing. But when you feel you're breathing, the breathing is difficult, you are aware that you are breathing or it's a labored breathing, then it has to be, especially if you have 40 years, it has to be seen seriously. So it could be a serious medical problem or a simple problem. Even it could be physiologically. Normally, if somebody does some exercise, we feel breathless. But the pathological or the disease part, and even these things, most of the patients they themselves they can know. If they have heart disease, heart attack, the failing heart, cardiac failure, or water collection in and there around the heart. So definitely the heart cannot pump the oxygen, the demand is more and heart is not able to meet that. So they may maybe feel breathless. They are, then lungs, where the oxygen carbon dioxide exchange happens, when oxygen cannot in. Simple is, uh, asthma or COPD, where the lung is destroyed, where the exchange of oxygen cannot happen, so they can feel breathless. Or somebody's water collection in the body, suppose your kidney is failing and you have a water collection, then it could cause breathlessness. Normal physiologically, pregnancy, pregnant women, the baby is growing, so it lifts the diaphragm, so oxygen, air entry is reduced, they can feel breathless. This is normal physiology. What are the simple problems that can have cause this breathlessness? The first and foremost is weight gain or obesity. Suppose a person gains 10% more weight. So normally a person can be 70 kg. Now they are 70, 75, 75 to 77 kg weight. So the breathlessness, the breathing becomes labored, especially when they climb stairs, they do exercise, they can feel breathless. So morbid obesity. So the BMI increases. Somebody is 30 kg, 40 kg, more weight. So breathless is more. So they be very aware of their breathing. It's like a choking for them. So this is obesity is the first and foremost. The second is anemia, especially women. Anemia. So the hemoglobin level is low, so the oxygen carrying capacity is low. So when the demand is more, especially when you're doing exercise, walking, climbing stairs, the heart cannot match up the oxygen demand, so causes the heart breathlessness. This is the second commonest reason. The third is low sugar. Suppose somebody is diabetic and they have low sugar and they are doing some exercise or climbing stairs, they can feel the breathlessness. So low sugar is again possibility. The other is simply, suppose they have a septal deviation, so they call the deviated nasal septum, DNS, or they have a tonsil or the nasal block. Suppose there is a nasal block. So when they are when the demand is more for the oxygen, especially running, climbing stairs, so the air entry is reduced. So they usually do mouth breathing. and they can feel the breathlessness. These are and of course, like hypothyroid. Suppose somebody is hypothyroid, naturally their metabolism is slow and they gain weight. Again, breathless can happen. And very importantly, we can say somebody is have a GERD, acid reflux. I mean, the GERD has acid reflux is there, and after taking food or after taking a lot of water, and these people when they do exercise or walking or they are climbing stairs, the acid reflux happens. That can cause breathlessness. So breathlessness could be a major health issue, or it could be a simple problem. But if you're 40 years and you are aware of your breathing, always consult your doctor and have a solution. Thank you.